this is Dr. Lloyd here for Chapter 28, Pregnancy and Human Development. Okay, so for the first week or so, our little fertilized egg is referred to as the conceptus, and then the embryo up to about 8 weeks. From there, from like 8 to 12 weeks, begin to call this a fetus, and greater than 12 weeks, all the way to birth, would still be fetus. Okay, we talked a little bit about the reactions that were needed for the sperm to fertilize the egg. The first is the acrosomal reaction, where many different sperm will empty their acrosomal enzyme content to the zona pellucida to break it down and eventually set off a cortical reaction. And this is still the acrosomal reaction. You can see the enzymes are breaking down the zona pellucida. Now the head of the sperm is going to fuse with cortical granules. Now these granules are filled with calcium, and they are set to kind of explode all at the same time. And so this is a block 2 polyspermy, which means that the first sperm that comes in is the only one that is going to inject its nucleus into this ovum because of this cortical reaction, where the cortical granules, once activated, will set up a chain reaction where they activate all around the egg, and this blocks further sperm entry, establishing monospermy. Now, the actual time of fertilization is when the male and female pronuclei combine. So you'll see once they combine that immediately the next stage will be seen through cell division and cleavage. Here's a little video showing the site where the time of fertilization, so it shows the two pronuclei. So fertilization is occurring right now, and now we start our cleavage and start to make our morula. Okay, so if we look at the path that the oocyte takes, firstly, fertilization is going to occur in the oviduct. As the oocyte is getting swept downstream into the uterus, the fertilized egg develops into a zygote, then a morula, then a blastocyst. Blastocyst will then become a hollow ball, and this blastocyst is going to implant into the endometrium for further development. Now at day 4, this is day 4 after ovulation, the ovum is going to hatch from the zona pellucida and begins to adhere to the endometrium and implant. You can see by day 9, implantation continues. To day 11, we can make out the yolk sac and an embryonic disc and an embryonic cavity. Okay, so at fertilization and until birth, there are various hormonal changes. The first hormonal change, really, is the spike in human chorionic gonadotropin. This is what many pregnancy tests will test for. What? Sorry. So pregnancy tests will test for this spike in HCG. Looks like it's probably by around 4 weeks you can detect it, and this spike lasts several weeks. then we can see that there's just a general rise in estrogens and progesterone for the rest of gestation until we reach 38 to 40 weeks. Okay, so let's back up a little bit to day 8. We're implanting the blastocyst, and day 12 we have further development of the yolk sac and the amnion, as well as the maternal blood vessels are organizing into a chorionic villi. By 16 days, we have uh, gastrulation that has occurred, and I know that because I see our 3 primary germ layers, ectoderm, mesoderm, and endoderm, which have showed up. We still have our yolk sac. This is going to turn into the gut, and we've got our amniotic cavity. By 4.5 weeks, the decidua basalis and the chorionic villi are fully developed. This chorionic villi can be sampled to sample the fetal blood for different abnormalities. By 13 weeks, the fetus is well developed, and let's see, the fetal blood, if you could look at the umbilical cord, which is going to contain all of the maternal blood coming in and the fetal blood going out, we can see development of many spiral arteries. These are the maternal arteries of the endometrium. And so gastrulation is the process by which 3 germ layers are produced. And what happens is a primitive streak is formed, and as the cells of the embryo migrate past this primitive streak, they will differentiate into mesoderm, ectoderm, or endoderm. Involves folding, further folding also. This is probably neurulation. So we're looking at creation of gut and then of the notochord and neural tube. So we've encountered gastrulation to create our 3 germ layers. Then neurulation will create uh, many different structures. And really what's happened is scientists have fate mapped every cell of this embryo and determined that the organs come from certain areas. So we have the development of our mesoderm, what's called intermediate and lateral plate mesoderm. This will form a number of organs. Our neural crest is forming. Now we've got formation of the neural tube, as well as the notochord and what's called somites. Now your somites develop into the dermatomes, which are the skin, your myotomes, which form the skeletal muscle, and sclerotomes that form the vertebrae and ribs. Other areas of fate mapping have shown that the lateral plate mesoderm gives rise to limb buds, the gut, different serosa. So here we have an outline showing that the ectoderm after gastrulation is going to give rise to the epidermis, the brain, the spinal cord, as well as the neural crest, whereas the endoderm is going to give rise to digestive organs of the abdomen, as well as glands, epithelial linings of the digestive and respiratory tract. And then the mesoderm is going to form the many organs like the kidneys, the gonads, different somites, the blood vessels, bones, utero, the fetus has a number of adaptations that have allowed for development thus far. And the first one is the placenta. This is just the site of gas exchange where the wastes of the CO2 are getting rid of from the fetus, and the oxygenated blood comes in via the mother to umbilical arteries. One coming in actually is one umbilical vein, which carries oxygenated blood. This is one of the exceptions to the arteries always being away from heart. And then we've got two umbilical arteries which carry deoxygenated blood from the fetus to the mother, to the placenta. Then there are three shunts. There is the ductus venosus, which is present in the abdominal aorta, and there's a shunt which allows bypassing of this fetal liver. The next shunt is in the atria. It's called the foramen ovale. This shunt allows for blood to move from the right to the left atrium, bypassing the lungs. The next shunt is called the ductus arteriosus. This further bypasses the lungs, and its shunt carries blood from the pulmonary trunk to the aorta. So the ductus venosus, fetal liver, and the ductus arteriosus bypasses the fetal lungs. The foramen ovale also further bypasses the lungs. And the reason is because the mother is doing the gas exchange and the filtering or detoxification of the blood. It doesn't need to be processed twice. Those passageways close up and become little ligaments. So the ductus venosus becomes the ligamentum venosum. The foramen ovale will close, and the ductus arteriosus becomes the ligamentum arteriosum. So the fetus approaches birth, these three shunts will close. And here is a summary showing the foramen ovale diverting blood from the right to the left atria, the ductus arteriosus, which diverts blood from the pulmonary trunk to the aorta, bypassing the lungs, the ductus venosus carries blood from the umbilical vein, bypassing the liver, and then we've got umbilical arteries and one umbilical vein. The umbilical vein is what carries the oxygenated blood from the mother through the placenta to the fetus. Let's look at some hallmarks of development. At 8 weeks, the head is actually the largest portion of the body. The limbs are present and developing, and ossification of the bones has begun. The heart at 8 weeks is fully functioning. 12 weeks, the skin starts to develop. The liver begins to activate. By 4 months, the brain is almost fully developed, with the cerebellum one of the last structures to develop. By around 6 to 7 months is when myelination occurs of the spinal cord. And then 38 or 30 to 38 weeks right before birth, there's a lot of fat development in hypodermis. The skin thickens. And as we approach, really starts to induce the process of labor, and this fetus increase in what's called cortisol is in response to corticotropin releasing hormone. And as the baby engages with the cervix stretches and establishes a positive feedback cycle where stretch leads to more pushing and more prostaglandin, oxytocin release. This leads to more pushing and more stretching and more oxytocin, prostaglandin release. And this is initiated through the events of fetal cortisol that will begin this positive feedback lesson in labor. So let's look at the stages. The stages of labor, 1A is when the cervix is dilating. 1B is late dilation, but the birth has not occurred yet. Stage 2 is expulsion of the baby. And stage 3 would be the afterbirth of the placenta. That's got to pass out. And then there is a fourth stage, which is really just completion of your first 3 stages with your birth being complete. One final feedback mechanism is once birth has occurred, milk production and release has to ensue for the baby. This is achieved through hypothalamic factors like prolactin releasing factor. And prolactin is released from the anterior pituitary. That's going to increase milk production. Now, it's going to increase milk ejection is oxytocin. That's from the posterior pituitary. And the actions of prolactin to kind of load the breast with milk and oxytocin to initiate ejection is called the letdown reflex. And this is the process of milk flow from the mother to the fetus, or to the baby at this point. And that is the chapter. Okay, I'll see you for the next one.